know that President Cyril Ramaphosa announced last week that the National Coronavirus Command Council has decided to keep South Africa on alert level 1. Now, the decision comes after a meeting with the council to discuss South Africa's discovery of the Omicron variant of COVID-19 and the surge of cases. As South Africa enters the festive season, many people will prepare their journeys and family celebrations. South Africa's COVID-19 cases surpassed the 16,000 mark in the last reporting cycle. Joining me now to discuss whether the decision to keep South Africa's lockdown unchanged is Associate Professor at the SAMRAC Centre for Health Economics at PRICELESS SA of the Wits University, Professor Susan Goldstein. A very good morning to you. Thank you so much for joining us. South Africa is well into the fourth wave. We've already surpassed the 16,000 mark, which is really a frightening scenario, especially as we listened to what Health Minister Dr. Joe Phaahla had to say yesterday. He said that new cases have increased by more than 300% in the last 7 days.
Yes, thank you. Good morning, Paul. And to your viewers, it is a scary scenario, but I think that what we have to do is moderate our response because we've been here before. We've now into the fourth wave, and we have quite a lot of experience now in a whole range of different ways of dealing with this epidemic, but also remembering that we now have a vaccine which is effective.
With the effectiveness of the vaccine come many other questions because, on the one end, we've heard some of the remarks that have been made with business and civil society having warned the president to say that the country will face significant backlash if the reinforcement of stricter lockdown measures are put in place. And then there's the question around vaccines. I mean, we only know that only about a third of South Africans are vaccinated. And gathering from some of the latest findings, a lot of those people who are in hospital, 2% of them are vaccinated and the rest are not.
Yeah. So I think there are lots of things to consider, and the knee-jerk reactions is not necessarily the one that one should think about. I think first of all, you have to think about unemployment, and being in a country with massive inequality and unemployment rates of over 40%, it's just untenable. People cannot live. People are hungry. Families just don't have enough money to live on. So I think the idea of a lockdown at this point it's just not livable. And I think that the point is you have to weigh as a policymaker, this on one hand and the epidemic on the other. We have got other ways of preventing the spread of this virus and of dealing with it. So although, yes, some very small percentage of people who are vaccinated do get into hospital, it still is very protective from severe illness and death. And so it's a choice that people have to make, and there is a consideration of mandating it, that people must get vaccinated. If you're vaccinated, you have a certain amount of protection. None of us are protected from many, many diseases, for example, from the cold or from flu, unless we get vaccinated or we stay away from other people. Yet we get sick. People die from the flu as well. We have to learn to live with this virus in a way that we've been living with other viruses all along.
And, as you speak about vaccination, we also have been listening in to various experts, of course, like yourself, speaking about, irrespective of this new variant, the evidence is clear that the best protection over illness is definitely vaccination. With the mandatory options on the table and a lot of the government officials also speaking to perhaps sidelining those who choose to not be vaccinated and restricting their movements as opposed to the overall who are vaccinated and willing to get vaccinated, what sort of conversations do you think that solution will perhaps spark should then the decisions be made around mandatory vaccination?
It's a very interesting discussion, and I think that what's important to think about is that these are choices that we have to make as a country. So the choice is, do we lock down and we stop spread of people, moving, people can't move, etc. And then they are very, very stressed and hungry and poor. I mean, is that one of the solutions? The other solution is a solidarity solution, where what we do is we vaccinate, which is completely harmless, and I have been vaccinated twice with J&J, completely, it makes you feel absolutely fine. And then protecting other people from severe illness and death. And I think that that's the choice that we have to make. With the mandation, it's not a law. So if you think of it like this, the law is that we are not allowed to kill other people. The law is we are not allowed to drive without wearing seatbelts. The law is that we're not allowed to drive our cars as fast as we like because it can harm other people. And the idea behind mandating vaccine is not really so much for your life, but for your own, for your families and for the society in general. So as people say, it's an Ubuntu or solidarity intervention where we're looking at keeping the government and the economy going so that we can deal with this issue. So sidelining, if that's what people choose, then that's what they choose.
South Africa's economy has already been battered. It was on its knees before COVID-19, and now COVID-19 has exacerbated the situation. When it comes to perhaps some really high-level talks and considerations that will be made in the next coming days, the conversation before we stepped into this third variant was around prioritizing health or wealth, and it was a back and forth conversation. Now, as we take a look at how matters are standing with the country's economy, the unemployment rate, what do you think government will be considering in great depth before any announcements are made?
I think that the idea of lockdowns is really and if you think back to the level 5 lockdown that we had last year, it's around trying to help us prepare. So making sure that we had enough hospital beds. If you think of the banning of alcohol, which was really successful in stopping trauma patients so that it freed up space in hospitals, gave doctors and nurses space to operate and so on. And I think that was the big part of the reason for the lockdown. Now we are more or less prepared. We know what to expect. We are getting ready. We've got beds. We've got oxygen. If you listen to the Gauteng Department of Health, they're really trying to prepare to make sure that there's enough space, enough beds for people if this becomes as serious as wave 3 or more. So I think that the point about lockdown was for preparation. It's been shown to be not very effective to stop spreading. And if you listen to Prof. Mahdi, he reckons that in Gauteng, around 79% of people have already had COVID at some point, probably without knowing it. So, yes, those are kinds of things that they have to think about. And of course, the economy and hunger. I mean, if you remember lockdown level 5, so many people were hungry. So many people just did not receive the food parcels or the extra money and time. It really was a very difficult time. And then the final thing that I would like to bring into the mix that they have to think about is other illnesses. We have to make sure that people, for example, who are HIV positive continue to get their antiretroviral treatment. That is essential. Otherwise, people can die. We can get resistant organisms, etc. So that's just one of the illnesses. Many other illnesses, such as high blood pressure, diabetes, need to be treated. And we need to make sure that this carries on. So I think they're going to put all these things into the basket and weigh them up.
And what about the education sector? I mean, looking at schools, universities, and so forth, we have seen some of the reactions coming out of talks of the mandatory vaccination being put in place when it comes to universities to protect the academic year of 2022. But how would this discussion then bode should then the mandatory vaccinations be introduced in schools for those who qualify between the ages of 12 and 17?
Well, it's quite funny because we already do have a mandatory vaccination policy for schools. You'll find that when children enroll in grade 1 at school, they are asked to produce their vaccination certificate against a number of illnesses. And that is not only to protect themselves, but to protect the community and to stop the spread of many awful illnesses. So this is not something that's difficult or new. It's actually just extending it to high school. I think I can't see that there would be a huge problem. Most parents and most people want to vaccinate and would agree with it. Mandatory just encourages people to get out of their house and go and get the vaccination.
And what about some of the latest research that has shown that a lot of children under the age of 5 are now being admitted into hospital when it comes to infections with the COVID-19 and of course, the aggression of the new variant?
Yes, so in fact, it's true that lots of children under 5 are in hospital. But what has changed is that when a child under 5 goes to hospital, they are tested for COVID. So they might be being admitted to hospital for something else, but they may be COVID positive as well. And we have noticed that many children, especially younger children, do get infected and often don't show many symptoms. So it's very hard to say at the moment whether there's increased virulence amongst young people and children. And so we don't know yet if it's just because of increased testing or it's because they're actually getting sick.
Very well. Thank you so much for your time and that analysis coming from Associate Professor at the SAMRAC Centre for Health Economics and Decision Sciences at PRICELESS SA, Wits University Professor Susan Goldstein, giving us some of the probabilities that may be in place ahead of some discussions and decisions that need to be made about what happens next when it comes to a lockdown and the possibility of mandatory vaccinations.